We told you Wake County has started scaling back its COVID-19 testing options.
Yeah, now with those sites closing, we wanted to find out what testing options you'll have and the differences in the PCR testing and at-home tests. CBS 17's Maggie Newland is live for us in Raleigh tonight with that, getting some answers. Maggie.
Rod and Angela, a lot of people have relied on these Wake County sites because they offer the more sensitive PCR tests, and the results come back pretty quickly in 12 hours or less generally. Now, as the county is phasing these out, the state says it is shifting its emphasis to at-home tests, but the two tests aren't exactly the same. When Virginia and John Musselman came down with COVID symptoms, rapid tests turned up negative at first.
The symptoms continued to get worse.
Even after John tested positive, Virginia tested negative for another day. Then different brands of rapid tests gave different results.
I was negative on this one twice, and then the one from Walgreens showed that I was positive.
There are people who test positive on day 1 of symptoms. Sometimes people test positive and they're asymptomatic. Some people may not be positive to day 3, even up to day 5.
Dr. Melissa Miller, the director of the clinical microbiology lab at UNC Health, says you can't always assume a negative rapid test is accurate, especially if you've been exposed and feel sick.
Because it's such a short time from when people are exposed to when they develop symptoms, sometimes early on you can be antigen negative and really have COVID-19.
Some brands of rapid tests are more sensitive than others, but PCR tests are the most sensitive. Wake County currently offers those at 5 drive-through sites with results in 12 hours. Once those sites shut down, options for PCR tests include pharmacies, but the results can take longer. Other community sites give PCR tests, but it's not clear whether they'll remain open indefinitely. The state health department says it's looking at the data and working with local partners to continue COVID-19 testing support based on community need and with an emphasis on at-home testing distribution. The Musselmans say at-home tests are definitely more convenient, but it's good to have several on hand.
Take a test and keep trying.
Now, the state does have a list of different places that have tests, and it says what kind of tests are available there, whether PCR or rapid tests. We have a link to that on our website, CBS17.com. Reporting live in Raleigh, Maggie Newland, CBS 17 News.
All right, Maggie, thank you.